Got a motion to approve the agenda.
So moved.
All in favor?
Megan? Good to see you, and Doctor.
And it is nice to see you in person.
Got a motion to approve the minutes from the regular meeting on August 7th.
Motion.
All in favor? All right.
The first thing I wanted to go over is our new services that we started with our providers. They started the we hired them effective August 24th. So the first little spreadsheet you'll see is for the month of August, and she only worked 4 days seeing patients, and we saw a total of 214 patients.
Y'all had an easy one.
Yeah. That was for August. Now, she was working contract 2 days a month before that, so 1 day is figured into her that. The next page is September, and we saw 388 patients. And we had a total of 446 visits. So when it says 446 visits, some of those could have been repeat checkups, is why it's not under the number of patients. So we did actually have 446
They
visits.
left the,
May have come back, may have come back the next week for a checkup or something. And then in October, we have saw 469 patients for a total of 562 visits. And I can tell you, we are very busy. The next one is a spreadsheet just showing the increase in our billables. The first one I'm showing you is before we had a provider. That's for the month of July. And I totaled it down at the bottom. We were able to bill $1,546 for July. If you switch over to August, which was, you can see at the bottom, we're normally seeing patients starting the 28th. The billing went up just for those few days, $15,555. Then for the month of September, we billed $59,252. And then October, she hadn't totaled those yet, but it's gonna be more because now we've got Megan in with one.
So how much additional support staff have you had to hire?
Well, we hired Val Menard, and she's turned her nose in and left, unfortunately. Today was her first day at Cherokee. She got a higher paying job, so she took it at Cherokee Hospital. She's the only one that we've had added other than one nurse, but we had that nurse position open prior to us getting providers. It was a vacant position left by the will. So we've only added one, and that was Fallon, and she, we're really needing to replace her because the girls in the front are covered up, and it's holding the providers up because we've got so many having to wait their turn to fill out the
It's
paper.
pretty good revenue to just leave.
Yeah.
What position are you needing to hire?
It's actually a clerical position to help.
You don't need to see any CNA or something like that.
We don't need to see a name, but if they can do part-time phlebotomy and part-time clerical like Fallon was doing, that would be perfect. Then we'd have a backup. Yes, that would be perfect. Because Fallon was doing both of those. The next area was our financials, and this is just our expenditure list, and I starred general health, item number 551, account. That is way off. Every one of the salaries for this year has come out of general health. So Martha has them broke down, and we're gonna meet with Stacy. We actually had a meeting for today at 1, so we can get it corrected, but she has a sick child, so we're gonna try to meet tomorrow, and that will work a whole lot different. And we don't have a revenue report for the year. They don't have those revenue. Hopefully we'll get that soon. We do have, the next thing on the agenda was our open positions, and we have one environmental health specialist vacancy. I did hire one, and she starts Monday after Thanksgiving. She is registered already with the state of North Carolina, and, she also has her master's degree in biology, and she's been working as a biologist in Tennessee, but she wants to relocate here, and she lived here years ago, so she's very excited to come back and to work in the environmental health field. Grants year to date, that's on your last page. We have got a total of $498,889 awarded so far for the health department, and I broke it down through our 5 grants. Peer support, we've got 3 grants for that, and Grace Focus Foundation has awarded us 2 grants, one for the providers and one for dental equipment. And I'm working with WNC Bridge out of Asheville Foundation, and we're doing a joint application for a grant with the state Division of Health and Human Services. If we get it awarded, it'll be a 3-year grant that'll give us $150,000 each year to help pay for provider services. So our deadline for that is in July, so we're in January to get that 3-year grant.
And you had a meeting with it.
Yes, ma'am. And we had a meeting,
You had some suggestions.
yes. We did have a meeting this past week with Golden Leaf, and he was, Mr. Hamilton was, Scott, was very nice and gave us some good suggestions on avenues to take for a fitness center and health issues. So everything's looking positive, and I'm just trying forever that I can to try to get us more services for the county, because people are happy that we're available 5 days a week and providing services. And the good thing about it too, when they're coming in for sick visits or just for an appointment, we're automatically pulling up their immunization record and saying, oh, by the way, it's time for your tetanus, or oh, by the way, it's time for your flu. Would you like to get it while you're here? And it's amazing how many are saying, yeah, let me just go ahead and do it while I'm here. So it really is a good service to the community, and I think people are happy that we're providing more health services.
Did we find a replacement for last counterpart in that peer support?
Yes, we hired Maria again, and she's doing very good, and she's actually joined a committee, or I'm sending her to a committee that Sunny's over, and she just finished her training. So she got her training completed last week, and she's very excited and wants to help you. Yeah. I think she'll be a positive person in that. Yes. She's very anxious to hit the ground running and meet with people in jail and people that the police department or Kelly Colonel's help, because she said, I've been there. I know firsthand, and I know how it affects your whole life for a child. So she'll be a good person, I think, in that position. The next item on our agenda was the fitness center update. We have raised $5,628 so far just in private little fundraisers for the fitness center. We have met with several foundations and talked with them about grants. Once we have land appropriated, then the grants they are telling us will probably be pretty easy for us to get to build this center. But the problem is, of course, like I told you before, is the property. Kim and I talked, and it's been suggested to the center that maybe we could use some of on West Fort Hill.
Up on top.
The flat would be a green parking area, and then we could build right behind the senior center. And then the seniors, we could have a sidewalk coming out, because they go to Franklin now just to try to get all their practice and exercises in for the senior games. So they could walk right there, or even somebody in a wheelchair could roll over and do exercise, and it would help them.
We have their scope, you know, because they're the senior center of excellence, so they had an adjoining pathway to the exercise center, then it would just help them, it would keep their accreditation.
So that was suggested, and then, of course, we left it tabled before about the property here in town. The sooner we can nail down property, the faster that the task force for the fitness center can move forward with getting these grants to try to start the building.
Okay. We'll figure it
And that's all I have, unless you have any questions.
out. Pretty much anything.
I just want to say I really appreciate the work that we're doing.
Thank you.
Thank you for very little things. Or they can't hold up their hand.
I'm just thinking, they all just do it. That's all that matters to me.
Well, you stand there, her patience, which is good.
Got any new own business? No? Thank you. All right. Any public comment? All right, Friday, I will have the statute from me.
ES 143-318, 11A6 for personnel.
I'm going to, I'll take a motion to go into closed session under that statute, personnel and contracts.
5 and 6.
And when they got it on.
Yes.
Is there a motion?
Kind of